U.S. President Donald Trump has unveiled the framework of what he's calling the Great Healthcare Plan, a sweeping proposal he wants Congress to pass as Americans face rising medical costs and insurance premiums. The announcement comes as federal health subsidies expire, putting pressure on Republicans to offer an alternative. In a recorded video released by the White House, Trump laid out the core idea behind his plan in simple terms.
Today, I'm thrilled to announce my plan to lower healthcare prices for all Americans and truly make healthcare affordable again. We're doing things that nobody's ever been able to do. We're calling it the Great Healthcare Plan. Instead of putting the needs of big corporations and special interests first, our plan finally puts you first and puts more money in your pocket. The government is going to pay the money directly to you. It goes to you, and then you take the money and buy your own health care. Nobody's ever heard of that before, and that's the way it is. The big insurance companies lose, and the people of our country win. This proposal locks in the massive discounts on prescription drugs that my administration is achieving through our most favored nation drug pricing agreement. Now, when you hear about that, for 40 years they've been trying to do it, but they never were able to do it. No other president was able to do it. I got every other country to approve it by the use of tariffs and other things. They all approved it. Nobody else got it. No other president got it. And for the most part, they didn't even try because they felt it was impossible. It'll bring down drug prices 80, 90%, in some cases, just numbers that nobody's ever heard of before. Your prescription drugs will come way, way down. And under this policy, the prices of many drugs will be slashed by 300, 400, and even 500% starting this month at the TrumpRx.gov. So instead of Americans paying the highest drug prices in the world, which we have for decades, we will now be paying the lowest cost paid by any other nation. So any other nation that's paying the lowest cost, that's what we're going to pay. And the American people will get the savings. So I have to reiterate, the lowest price in the world is what you're going to pay. Before, you were paying the highest price in the world by far, and the politicians did nothing about it. So I'm asking Congress to complete the work that we've started. Next, my plan would reduce your insurance premiums by stopping government payoffs to big insurance companies and sending that money directly to the people. Obamacare was designed to make insurance companies rich. I call it the Unaffordable Care Act, with billions of dollars in taxpayer subsidies that helped their stock prices skyrocket over 1,700%, as you paid more money for health care every single year, more and more. The premiums went higher and higher. I want to end this flagrant scam and put extra money straight into the healthcare savings account in your name, and you go out and buy your own health care, and you'll make a great deal. You get better health care for less money. That way you can choose the care that is right for your family. To further reduce insurance premiums, my plan ends the giant kickbacks to insurance brokers and corporate middlemen that only drive up the costs, and that's what they're intended to do, drive up the cost. But we're driving down the costs. And it fully funds a long neglected part of the law known as the Cost Sharing Reduction Program. This measure alone should cut premiums on the most popular Obamacare plans. It's hard to believe there are any because it's a hated program. It's unaffordable, but it's going to cut them by an average of 10 to 15%. Next, the Great Healthcare Plan. That's the name. It's called the Great Healthcare because it's great healthcare at a lower price. Mandates unprecedented accountability and transparency from insurance companies and all healthcare providers so that special interests can no longer profiteer at your expense. As the saying goes, sunlight is the best disinfectant. That is why my plan orders all insurance companies to publish rate and coverage comparisons in very plain English. It requires insurers to publish detailed information about how much of your money they're going to be paying out in claims versus how much they're taking in profits. In other words, you will be able to watch the scam. It forces them to release detailed data on how many claims are being denied and whether those denials are eventually overturned on appeal. And most importantly, it will require any hospital or insurer who accepts Medicare or Medicaid to prominently post all prices at their place of business so that you are never surprised and you can easily shop for a better deal or better care. And you're going to end up doing both. You're going to get a better deal and better care. We will have maximum price transparency and costs will come down incredibly. I'm calling on Congress to pass this framework into law without delay. Have to do it right now so that we can get immediate relief.
The White House said the plan Trump laid out in a taped video message would codify his efforts to lower drug prices by tying prices to the lowest price paid by other countries. The cornerstone is his proposal to send money directly to Americans for health savings accounts so they can bypass the federal government and handle insurance on their own.
The Great Healthcare Plan will accomplish this through 4 common sense pillars. Number 1, permanently lowering prescription drug prices. Congress can get this done by codifying President Trump's historic Most Favored Nation initiatives into law to guarantee Americans the same low prices for prescription drugs that people in other countries around the world pay. Additionally, by increasing consumer choice by making more verified, safe pharmaceutical drugs available for over-the-counter purchases. Number 2, the Great Healthcare Plan will stop sending big insurance companies billions in extra taxpayer-funded subsidy payments and instead send that money directly to eligible Americans to allow them to buy the health insurance of their choice. Additionally, by funding a cost-sharing reduction program for healthcare plans and ending kickbacks from pharmacy benefit managers to large brokerage middlemen. Number 3, the Great Healthcare Plan will maximize price transparency by requiring any healthcare provider or insurer who accepts either Medicare or Medicaid to publicly and prominently post their pricing and fees to avoid surprise medical bills. This is an incredibly popular policy that has been bipartisan for many years, and President Trump is officially and firmly calling on Congress to get it done. And number 4, holds big insurance companies accountable by requiring them to publish rate and coverage comparisons up front on their websites in plain English so consumers and everyday Americans can make the best purchasing decisions for them and their families. These are common sense actions that make up President Trump's Great Healthcare Plan, and they represent the most comprehensive and bold agenda to lower healthcare costs to have ever been considered by the federal government. Congress should immediately take up President Trump's plan and pass it into law. For Americans watching at home, you can visit greathealthcare.gov right now for more information on the Great Healthcare Plan. Mary.
Thanks, Caroline. The president says he wants money to go directly to Americans so they can buy their own insurance. How exactly would this work? And can the president assure Americans that this will be enough to cover their health care costs?
So this is the second principle in the president's health care plan, lowering insurance premiums specifically and ensuring that that money is going directly back to the American people and cutting the kickbacks that then raise those premiums. So this plan, once put into legislative text and passed by Congress and sent to the president's desk, will stop sending big insurance companies billions of an extra taxpayer-funded subsidy payments and instead send that money directly to eligible Americans to allow them to buy the health insurance of their choice through, you may have heard it be referred to as health savings accounts. Whether that ends up being the actual name of such accounts, we'll have to see. Again, Congress and the White House are going to work together to put this plan into action. And then secondly, the Great Healthcare Plan will fund a cost-sharing reduction program for healthcare plans, which will save taxpayers at least $36 billion and reduce the most common Obamacare plan premiums by over 10%, and that's according to the Congressional Budget Office.
But 20 million Americans in recent weeks have seen their health care costs soar. Can he assure them that if this plan is put in place, that they will be able to cover those costs?
If this plan is put in place, every single American who has health care in the United States will see lower costs as a result. They will see more transparency. All of these proposals that are within the Great Healthcare Plan are incredibly popular with the American people, and they will impact everyone, not just a small fraction of those who are within the healthcare marketplace, but every single American will continue to see their costs go down. And I will note that they already are with respect to prescription drug prices. When you look at what the president has done with Most Favored Nations, you've seen these big pharmaceutical companies in the Oval Office saying that this president and his team were nonstop around the clock pressuring us and negotiating with us to lower the cost of prescription drugs for Americans. And we are already seeing that to the tune, in some cases, of more than 500%. And that Trump RX website is something that the administration will be formally launching very soon, so Americans will have access to those lower costs of drugs.
Just to follow up on the health care plan, one of the things in the Affordable Care Act was coverage of pre-existing conditions. Is there any discussion or inclusion on that issue in the president's plan?
The president's plan that he outlined today will have no impact on individuals in this country with pre-existing conditions. Obviously, that's a continued conversation that the White House will have with Congress, but that's not the president's intention with the Great Health Care Plan.